Hi, my name is Claire. I'm a nurse practitioner with NP for NP's Nurtured Path for Nurse Practitioners. Today, I'm going to talk about the key to being an exceptional nurse practitioner. One of the expectations when we enter practice is feeling that we need to know exactly how to treat a patient, that we have all of the answers and we have them right now. I want to say that one of the best qualities of a provider is knowing what they don't know, and so that they're able to then ask questions and learn more to pick up that knowledge. There's nothing more scary than a provider, whether a nurse practitioner or physician assistant, assuming that they have all the answers and then forging ahead without questions, without using evidence-based practice to make decisions. That confidence, maybe cockiness, can lead to potential patient errors, which is very serious. And so I think that one of the superpowers of nurse practitioners, especially new grads, is that we know what we don't know. We're sensitive to what we don't know, and so we, as providers, we tread lighter, less aggressively with treating patients with medications. We ask more questions. We listen to our peers who know more, our collaborating providers, our colleagues who've been around longer, so that we are proceeding appropriately. We know the bounds of what we don't know, and so we try to fill that with knowledge and proceed very safely and carefully. And I think that's something that not all providers feel comfortable doing. Maybe our physician colleagues, um, because their physicians might have an expectation that they should know the answers. And so there can be a potential to feign confidence because um, based on training, there should be an expectation that they know what they're doing. And so they might not ask questions, and that can potentially lead to problems. And so as nurse practitioners, I think there's maybe a built-in insecurity that we know that there are things that we don't know, but because of that, we move forward, filling that knowledge gap and asking questions and learning more. And so I think it's important um, to use the superpower, I like to call it, of knowing what we don't know, um, feel that with confidence and use that to be an exceptional nurse practitioner, to continue learning more, to continue asking questions, and listening carefully to our experienced colleagues and to our patients in order to provide really quality care. This is the superpower that nurse practitioners have, and it's truly the key to being an exceptional nurse practitioner. If you want to learn more about tips and resources for new grads and students who are making the transition into practice, you can check out my website, npfornps.com, and subscribe to our mailing list there. Thanks so much, and I will see you next time.